The annual American Society of Hematology, or ASH, meeting happened recently, where DLBCL experts shared their research. Are there updates that patients should know about?
Absolutely. There are so many promising agents that were presented in a wide variety of different clinical trials, early phase or phase 1, phase 2, and also some of the advanced stage studies that were discussed. The most promising right now, I say in a relapse setting, potentially curative, is the CAR T. There was some long-term data, a newer platform of CAR T therapy, autologous. That means where patients' own T cells are modified. There are quite many products already approved. There are long-term data, safety and efficacy was discussed, very impressive. The new set of cellular therapy, which includes not only CAR T, but other immune cell like NK cell therapy, which are also presented, very impressive. Now remember, when you do auto, our own CAR T cells being processed, there is a time lag, about 2 to 3 weeks for preparing those cells. Compared to the others, they're over the shelf. Of course, all of this data were early, but they were very promising going forward. The others were bispecific antibodies. So far, what we have is the monoclonal antibodies targeting single antigen, like CD20 or CD19. But now we have bispecific, which targets CD20 on one end, but CD3, the T cell antigen on the other end. And those antibodies have proven very effective in all B-cell lymphoma and large cell lymphoma. And there are so many other agents in early phase, as we go more in depth going forward, we will know their efficacy and side effects and how they fare compared to the other approved agents. So a very exciting time for lymphoma patients so that even if it comes back, we have multiple options to have it back in remission and potentially cure going forward.
Yeah. Oh, that's great. How can patients learn more about emerging research?
Very important question. And currently, as we were discussing, Googling, sometimes it is not the right way because, it is unfiltered information and its sample size could be, different. Somebody has a negative experience and they would write that and, the person reading might have a different perception of the diagnosis and treatment. There are good websites, American Society of Hematology, American Society of Clinical Oncology, Lymphoma Leukemia Society. There are many other cancer society. They have good information available. But the most important is actually the responsibility, in my opinion, lies on the provider. When the patient comes and sees me, I make sure that I share the information with the patient. And I direct them to the right source of information. And it should be interactive. That means if they read something, if they have any question, they come back and ask me. At the end, it is our responsibility as a care team to be available, first of all, for any questions and provide the right information. What I've learned over a period of time that has helped patients quite a bit all across so that they don't have to wander around for non-specific information like on Google or other search platforms.